An estimated 16 million Americans live with irritable bowel syndrome with diarrhea. It's called IBS-D. Dr. Donnica Moore is a women's health expert and Salix Pharmaceutical spokesperson. She's my guest, and she has information about the current science behind the symptoms of IBS-D, the possible causes, and why it's so very important for people to speak with their healthcare provider about their symptoms, and, of course, finding the best treatment option that's right for them.
Thank you, Audrey. It's such a pleasure to be here.
What is IBS-D and what are the symptoms?
So in medicine, we make up really complicated names for things and then we come up with acronyms. So IBS-D is simply a type of irritable bowel syndrome, IBS, that's characterized by a really unpredictable diarrhea. And then other symptoms that people have are abdominal pain, gas, bloating, and then this sense of pretty characteristic urgency that, oh my goodness, if I don't get to the bathroom ASAP, I might have a really embarrassing accident. I think what sets it apart are three characteristics. The first is that it's unpredictable. So for example, if you have a stomach flu, you're 100% well one day, and then all of a sudden you have body aches and maybe a fever and diarrhea. Okay, pretty much you know that that's going to last a week to 10 days and then you're going to be fine. With this, there's also a chronic, unpredictable nature of it. So people can have flare-ups, they can have episodes, they can have time periods where they're fine, and then all of a sudden out of nowhere it can flare up again. Some people have symptoms every day. It really varies. So the characteristics are unpredictability, the chronic nature of it, and also that sense of urgency. Even when you have the stomach flu, you could you have a little warning. With this, not so much.
And what should people with symptoms of abdominal pain and diarrhea do?
The urgency is just like this sense that I've got to go. But the other thing is there's a wide range of symptoms. So some people may have really minor symptoms, and some people may have symptoms at the other end of the extreme. I don't want anybody who's watching this today, sitting home in their living room, trying to go through a checklist and decide if this is what they have. If you're having any abnormal abdominal symptoms, your responsibility is to make the phone call and call your healthcare provider and make an appointment. Then it's your doctor's responsibility to do a full history and a proper medical exam and do all the diagnostic tests and to make a judgment about what you may have. You could have any other kind of gastrointestinal problem, but as you know, your intestines are not really something that you're typically supposed to be thinking about more than once or twice a day. And usually most people's bowel habits are pretty predictable. But when they're unpredictable, that can be very unsettling, and it can really interfere with your activities of daily living.
Who's typically affected?
So, unfortunately, this is an equal opportunity offender. We don't have like a classic typical patient. It can affect anybody at any age. It affects women slightly more than men. And this is why I talk about it on my podcast, In the Ladies' Room with Dr. Donnica, because it is more commonly a women's health problem. But I think women are also more likely to go to the doctor when they have it. It can affect people of any age, any race. There are some risk factors, however, that people can have. So the risk factors, as always, family history can be a risk factor. We used to think that people who had anxiety or depression were much more likely to get IBS. Now our thinking is adjusted a little bit that maybe it's maybe we're in a chicken and egg situation where the IBS-D is actually causing the anxiety and depression. But we also know that having had a history of taking antidepressants can also increase your risk for IBS. Having a history of taking antibiotics can increase your risk of IBS-D. And in fact, one huge study done in the military of people in active duty military who developed IBS-D for the first time, they did very thorough history, and of course they had access to all their medical records because they're in the military, and they found that people with IBS-D were much more likely to have had a previous episode of food poisoning or of infectious gastroenteritis that happened before all their symptoms started. And we know that there's about 10 million cases of food poisoning a year in the United States. So that can be a very common risk factor. What that research pointed us to is one of the potential causes of IBS-D, which is an imbalance in the gut microbiome. So another study found that of people with IBS-D, 73% of them had an imbalance in the gut microbiome versus only 16% of healthy individuals. So of course, the gut microbiome is something we're reading a lot about, we're hearing a lot about, it's generating a lot of scientific enthusiasm and interest, and it's showing us an area to really focus on from not only a research perspective, but also from a therapeutic perspective, which is very exciting. So we now have something to offer people to treat that imbalance in the gut microbiome.
And in terms of treatment options, what's available for people with IBS-D?
So the treatment options range, and again, I told you the symptoms range. So obviously somebody with very mild symptoms is going to get a very different recommendation from somebody at the opposite end of the extreme. But your doctor will probably talk to you about lifestyle changes you may need to make, foods you may need to avoid. Of course, this is a condition like anything. Increasing exercise may help. Increasing stress management may help. If you also have anxiety or depression, your doctor will also recommend treatment for that. But I want to caution people. I know a lot of women in particular get really upset when their doctor recommends treatment for depression because we think that means your doctor is thinking this is all in your head. This is definitely not all in your head, and your doctor is not thinking that. We just know that treating the depression in addition will also help the other symptoms also get better, or will help you respond to other therapies better. And then the specific GI therapies or gastrointestinal therapies range from fiber, antispasmodics, to other prescription therapies that are more targeted for the imbalance in treating the gut microbiome. The bad news about the therapies is that 50 to 70% of people who are recommended the first-line therapies of fiber and antispasmodics don't respond. And what I'm worried about is I don't want those people to just get frustrated and give up and say, okay, the therapy didn't work for me. It's a stage, and there's graduated levels of therapy. So you have to go back. Even if you have strep throat and your doctor puts you on antibiotics, if you don't get better, you have to go back and say, I didn't get better. So same with this. If your doctor puts you on antispasmodics or fiber and you're not getting better, you have to go back for follow-up and you have to speak up.
And where can we go for some more information?
So of course, I know I say this all the time, but the most important place to go for more information about your own specific health issues is your own personal healthcare provider. But if you want additional background information, there's a great website, IBSDupclose.com. And that can give you tips about making lists of questions to ask your doctor, talking about your symptoms, reading about other patients and the kinds of situations that they've had to deal with, etc.
So be sure to check with your doctor or healthcare provider if you're experiencing the symptoms of IBS-D. Thank you, Dr. Moore, for joining me.
My pleasure. Thank you, Audrey.
You're watching Talk with Audrey, and I'll be right back.